Rovin. I'm a nephrologist and a professor of medicine and pathology at The Ohio State University in Columbus, Ohio, in the United States. And so today at the Lupus meeting, one of the talks that I gave had to do with looking at the kidney biopsy of patients with lupus nephritis in a much more detailed way than we usually do. Clinically, when we get a kidney biopsy, it goes to our pathology department and we look at it under the microscope, and we do special staining, and we look under another special microscope to see really fine detail called the electron microscope. What we want to do is understand what else we can learn from this valuable tissue that we've obtained from patients. And so the work we're doing in several projects, including projects with the NIH, is to look at the gene expression of different molecules in these tissues. And the reason we can do this is because of many advances in technology, and one of the really exciting ones is spatial transcriptomics. So we get a picture of the kidney, and then the genes that are expressed, we can see where they're actually being expressed in the kidney itself. And what we're finding is a lot of expression of inflammatory cells and different states of inflammatory cells that may have to do with kidney injury in lupus and may provide us with potential targets therapeutically. We're also learning that disease flares. So when you first have a diagnosis of lupus, get better and then flare again, the pattern might be a little bit different than when you first started, and so the same medications that worked the first time may not work the next time. We're also learning that some types of lupus nephritis, which we sort of consider not very active, actually called class 2, actually do seem to have a lot of inflammatory cells and infiltrates. So my hope is that as we actually really understand these results, and these are very early results, so it's going to take some time, that we can start to really look at an individual patient's kidney biopsy beyond what's on the microscope, look at it in the context of a molecular diagnosis, and then maybe use that to really form therapies that are personalized to that particular person or individual. Thank you.